I'm Professor Kimberlie Dean. I'm head of the discipline of Psychiatry and Mental Health at the University of New South Wales. This year marks 60 years of psychiatry and mental health at UNSW, which is a really amazing milestone. Of course, I've only experienced the last decade of that 6-decade journey, and I feel an enormous privilege to have had that opportunity and now to be leading the discipline into the next decade, towards the 70 years. The discipline of psychiatry and mental health at UNSW has been around for over 60 years now, and the research that we cover is right across the board in mental health. So we are one of the largest groups of researchers, educators, clinicians, and advocates working in the mental health research area in Australia now. And we have a large group of students, a large group of researchers receive a significant amount of research funding. We work with a number of partners, including Mindgardens, which is an alliance between 4 individual partners. So 2 medical research institutes that we work with a lot, Black Dog Institute and Neuroscience Research Australia are part of that Mindgardens Alliance, as well as a key health service partner, which is South East Sydney Local Health District. And we also work with a number of other health services around Sydney and beyond in New South Wales, as well as some private healthcare providers. We work with St John of God, with Karitani, and a whole range of other individual groups. We are very fortunate to be working with James Packer and the Packer Family Foundation. They have made a very generous donation of $7 million over a 10-year period to support a chair in bipolar research. Bipolar disorder is a very important mental health condition. We don't have a full understanding about what causes bipolar disorder, and it can have really significant impacts on people's lives. So this research and the donation from James Packer and the Packer Family Foundation will have a real impact on answering some of those questions. Our appointee, Associate Professor Aswin Ratheesh, his focus is really on the early phases of a disorder like bipolar disorder, how it starts, what makes people vulnerable. Is there anything you can do in that early phase to prevent things deteriorating? And what about young people who've got a family history? Are they at increased risk?
I've worked as a psychiatrist for about 13 years now, and in this time I've been really struck by how young people and even young adults with onset of bipolar disorder struggle to access care, and hence I've developed this digitally based early intervention model for youth with bipolar disorder. This is now being translated in the clinic. We also have a program evaluating this model in a 5-year RCT. So I hope to bring this to UNSW. But also, I'm interested in the onset of bipolar disorder and the factors that can help us predict who might later develop this condition. I've led a number of studies in this area, but we need larger studies that can help us understand this question and unpack the particular challenges of the way complex mental disorders evolve. I'm also interested in the intersection between bipolar disorder and other mental health conditions such as depression, anxiety, and psychosis, and this is another area of interest that I hope to research further at UNSW.
Well, I think everyone now, knows people, or if they themselves haven't been affected by mental illness, someone in their family or their broader community. It's a very common experience, has an enormous impact on people's lives. So it's really important to better understand these conditions, like mood disorders in general, so depression and bipolar disorder in particular. Apart from the benefits that can come to individuals who might be at risk of developing those illnesses or develop them, the broader community can also benefit. There is enormous impacts of mental ill health on our broader community, on the ability of people to contribute in their communities. There's an economic cost to our growing mental health crisis in Australia and beyond. So there's a lot of potential benefits, I think, to society more broadly.
In the last 2 decades, we've had a number of long-term follow-up studies that have suggested that people with certain brain function difficulties, certain brain imaging markers such as brain thickness or connectivity between different areas may be affected in people who may later develop bipolar. But a key challenge in a lot of these studies is that we're limited by power and smaller samples, and we also have a problem with specificity. We don't quite know the unique risk factors for this condition, as a lot of these biomarkers are shared with a number of other different conditions. But it might be a matter of trying to understand the different subgroups within bipolar, psychosis, and other major mental health conditions, and to understand common pathways into these subgroups rather than necessarily individual conditions. But also symptoms such as sleep, depressive symptoms, and other early life difficulties may also be pretty good markers that can help us identify who might later develop bipolar.